So next we have Dr. Suchitra Bhatt, who is going to talk on sarcoidosis in a child, an interesting encounter. Dr. Suchitra Bhatt is a medical retina consultant at Ashoka Hospital, Kannur. Over to you.
Pointer. Good morning, everybody. I'm going to present a simple cases which I encountered in a child. So, offering my pranamas to my guru, teacher, mentor, late Dr. B.B. Bhatt, I'm going to start my presentation. Mine was a young teenage girl who presented to our OP last year, who is aged 14 years, who presented to us with floaters in right eye since 1 week. On examination, both eyes vision was 6/6, though the right eye was little blurred. Anterior segment was absolutely normal. Posterior segment showed dense vitreous hemorrhage. We couldn't make out any other details. So as we usually manage the vitreous hemorrhage, we asked her to rest for 1 week, give vitamin C tablets, and advised a propped up position. And 1 week follow, she showed clearing vitreous hemorrhage. Central fundus was still not clear, but periphery we could see, and we were expecting a tear hole. Nothing of that sort was there. So our diagnosis could not be complete. So we asked her to review after 3 weeks. Then after 3 weeks in April, she comes back now actually with diminished vision in the right eye, that is about 6/12. On examination, her vitreous hemorrhage was resolved, and we could see here, as shown, a clear-cut neovascularization superior to the disc and inferior to the disc, with the obvious clear-cut macular edema confirmed by the OCT that was responsible for her decrease in vision. So what do we do when we see a neovascularization? We do a FFA. So this is a FFA photograph showing initial minimal staining of the blood vessels. This is the periphery in the mid phase. I want you to see that there was no choroidal non-perfusion areas usually we see in any neovascularization. And this is a late phase showing clear-cut neovascularization and obvious macular edema. This is the left eye of the patient, which was absolutely normal. Since there were, this is the summary of the FFA, we can see the clear-cut neovascularization, and in the last photograph, you can see the periphery with mild inflammation of the blood vessels and without absolutely non-perfusion areas, and the left eye was normal. So now we were thinking that we were dealing something with inflammation. So a diagnosis of posterior uveitis was made. So we came to know that it is an inflammatory neovascularization of the disc. So I went back and searched, and we found that inflammatory neovascular disc is seen in Behçet's or sarcoidosis. Since patient didn't have any features of Behçet's, we thought it might be sarcoidosis and went ahead with simple investigation, which is done in a basic hospital. So investigation, serum AC, MAN2, toxo, VDRL, everything was normal. CT chest was absolutely normal. I discussed with the pulmonologist, was there any lesion? He said it was absolutely normal. And routine blood investigations, everything was normal. So we started, since it was not infective cause of uveitis, we started on oral steroids, 50 mg for 2 weeks with gradual taper for every 1 week. There was still only partial response. The neovascular disc was still there. It was neither increasing nor decreasing. So we thought we'll add immunosuppressants. We started with 15 mg per week with folic acid, and after 1 month we maintained her with 10 mg per week. Treatment continued till October, that is from April to October. We are giving her the same treatment, checking her blood test, everything was normal, same picture, NVD. So in November, now she comes back, actual picture of circumciliary congestion, scleral congestion, pain, grade 4 cells, flare, etc. And the disc showing still neovascularization of the disc. After this presentation, after 1 week after this, she developed the same vitreous hemorrhage, dense vitreous hemorrhage, which we saw in the beginning. So now it was a pan-uveitis picture. Sclera was involved, anterior segment was involved, and posterior segment was involved. So we were like almost sure now we are dealing with sarcoidosis. So patient was sent to the rheumatologist. Since she was not responding very well both to the steroids and immunosuppressants, we asked her to start for biologics, and he started on subcutaneous adalimumab, which was given once in 2 weeks for 14 doses. Meanwhile, since we were scared she had recurrent vitreous hemorrhage, we did PRP in 2 to 3 sittings. Anti-inflammation was carried out, was taken care by topical steroids, and oral steroids was restarted, and now everything settled. Choroidal inflammation came down, AC became quiet, oral steroids now we tapered once the inflammation came down, and we maintained her on immunosuppressants till May 2025. Blood investigations were absolutely normal throughout the procedure. Lesions was completely healing. So this is a last follow-up in November 2025. You can see the neovascular disc is healed, but there is a lot of fibrosis there. So in case of inflammatory neovascularization, when it heals, there is a lot of fibrosis. And this is the inferior segment of the same, which we took. This is the last photograph in October. Now she is not under any treatment. So she is only on regular follow-up. So NVD, that is neovascularization of the disc, is reported in small percentage of cases, that is in 4% of in study of posterior uveitis patient. NVD in sarcoidosis is associated with intraocular inflammation and usually occurs in the context of posterior or panuveitis. The inflammation is due to release of pro-angiogenic factors that stimulate new vessel growth. Usually, sarcoidosis has a good visual outcome, but development of complications like this, NVD or optic neuritis, can lead to severe visual impairment if not treated. So, any patient, early ophthalmologic screening is recommended for all patients with a newly diagnosed sarcoidosis, even if they are asymptomatic, to monitor for complications like NVD. Inflammatory optic disc neovascularization is diagnosed in cases where FFA does not really reveal extensive retinal capillary non-perfusion, plus you have an evidence of intraocular inflammation. Primary therapy for inflammatory NVD is systemic steroids or immunosuppressants. Intravitreal anti-VEGFs can be an adjuvant therapy. So I just want to discuss here, should we have given intravitreal the earlier, or PRP was required, was it really required, or we were like over?
I don't think PRP was indicated because neovascularization in the background of uveitis can be driven either by inflammation or by non-perfusion. So you need to do imaging to assess what is driving it, or whether it's a combination of the two. If the inflammation is what is driving it, you need to control the inflammation. I think the best way would have been to give intravitreal Osidex, one shot. So,
but since she was a girl, we were, she's just a 14-year child, so cataract and glaucoma, we were little.
One shot, sometimes it does the trick. Osidex is sometimes like a bullet. It just takes care of it, while you are treating the rest of it systemically. I think what really helped us the adalimumab.
Yes.
That's what I think. If there is significant CNP areas, you can add PRP.
Yeah, there was no CNP.
Yeah, you have to control the inflammation. That applies to not just NVD and NV, it also applies to inflammatory CNVMs. If there is an active inflammation, you need to control the inflammation, otherwise it's going to come back. I have one question for you. Why did you think it is sarcoid?
That is what... Yeah, because it was a panuveitis picture. So panuveitis is usually caused by TB, sarcoidosis, syphilis, or other things. So since it was going more in favor of, and research showed that the inflammatory neovascularization is seen mostly in sarcoidosis. That is why we made that diagnosis. She was not affording much for other investigations also.
Right.
So, that is why we stopped, and she was responding to steroids and everything. And rheumatologist also didn't ask for any other investigations. And in children, non-pulmonary manifestations are common. We searched for all those things also, and it was not there actually.
That is true. But having said that, if you look at the diagnostic criteria for ocular sarcoid, this patient doesn't fit into it. The management, is probably the same. So, it doesn't make a difference.
I just want madam's experience. What else in neovascularization? Which other disease you can expect here, ma'am?
In children?
Children or adults in neovascularization of the disc.
So inflammatory NVD.
Inflammatory NVD.
Which you can...
And for that matter, any vasculitis, like I think it would be more common with, something like with the occlusive vasculitis. TB, SLA. Behçet's, in spite of being occlusive, doesn't seem to produce that much of neovascular. So I don't know why. Yeah.
Thank you, Dr.